I'm Kirsty, I'm 26, and I'm from Chichester. My condition, it's obviously not my confidence an awful lot. I struggle every day with it. It's not normal.
I find it very frustrating, in all honesty. We want to just be able to enjoy our relationship together without having to struggle against the condition constantly. It almost feels like a battle.
Obviously, I really, really want it to go away.
Yeah.
But in the stage that I am now, just any improvement would be some kind of success.
Back then, I didn't really know anything about my issues. So it's quite different now that I have such a view on them that I can actually think about what I'm doing and think about why it's affecting me. The problems were hair pulling and anxiety, with no real knowledge of why, of any of it. So it was quite isolating back then.
What can I do for you?
I have trichotillomania, so I pull my hair out.
Pull your hair. Where do you tend to do that?
Mostly on my head,
Yeah.
sometimes my legs and sometimes intimate areas.
Okay.
Trichotillomania is a compulsion to pull out your hair. This obviously changes the appearance, can look strange, can make them feel very self-conscious, give them self-esteem issues, depression, and they can become very isolated because of this condition.
The hair pulling started when I was 12 or 14, I can't remember which now. I think it was 14 when I started pulling my hair out. And originally I have no idea why I did it. And it just became a habit that I never stopped. It goes through bad phases and good phases, and it's sort of an obsession over the hair itself rather than anything else. So I guess it's a distraction from anything.
What would you like in the ideal world?
I'd like to not have to do it.
How's your hair now?
It's fairly patchy and thin.
Can I see it, or would you rather not?
No, you can see it.
Show me, show me. Just so I know how
I
much.
might let it down and just...
That's all right.
I know for a fact that I don't feel or look any better after a session, but something obviously keeps me going during that time that makes me feel like it's worth doing. It's got to a point where it might not grow back at all, so every time I have a bald patch, I wonder if it's going to come back through.
Just mainly on the top, isn't it?
Yeah.
Round in a sort of circle like this.
Sometimes I'll spend ages in the mirror just trying to find the hairs that I want to pull out, and my hands will get sore, my arms, they start to go numb, and it's physically draining as well as mentally tiring, just staring at my hair, trying to get this one thing perfect for some reason.
When I would pull my hair out, I would go downstairs and I'd get a cup of ice and fill it with water. And I'd sit in front of the television and I'd pull individual hairs out from the top of my head, one at a time, for a while. It was important to have control over something when everything else felt out of control. How well I did at school was out of control. Other people were out of my control, so people would do things that I couldn't change and didn't know how to handle at the time. My parents had been going through a divorce, so that was out of my control. So a lot of things were changing. And things like I was expected to choose what I wanted to do for the rest of my life when I had no real idea at school, and I would forget everything, and that was out of my control, or seemingly so. So I would forget things like homework, and things that seemed so important at the time were out of my control. And people would shout at me for it, even though I felt like they weren't anything I could do anything about. So.
Do you feel like you've slightly lost hope?
Definitely. Yeah. I don't see any way of ever not pulling my hair out. I don't see that. I didn't realise how much it upset me.
It's quite good to talk about it, though, isn't it?
I never really talk about it to this extent.
The effect that it had on me at the time caused some depression, and I was very vulnerable in all of my relationships. I found it very difficult to hold a relationship down properly, with friends as well. They were difficult, mainly through education, not knowing why I was the way I was, and also having this disorder that caused me to pull my hair out and not know why. And as I said, along with the depressive episodes that followed.
Are you in a relationship?
Yes.
You are?
Yes.
What does your partner think about this?
He worries about it. He wishes that it could stop. You know, sometimes it bothers him, like the mess and you know, the sound of me pulling.
Have you worried that this would really affect or even end a relationship?
It has crossed my mind. I was thinking, like, when I've been through, like, depressive phases and very anxious phases, like, how much of this is Nathan going to cope with? Like, how much is he going to take before he gets fed up, basically? Nathan can find it quite difficult. He is bothered by it, and he doesn't keep that a secret from me.
I thought it would go away on its own, so I didn't really want to do much about it while I was at school. And becoming an adult, and when it didn't go away, I wanted to do something probably from the age of about 16. And I started trying to do things from around the age of 18. Various techniques, and shaving my head and wearing wigs and putting barriers in the way and all sorts of things I've tried. It's really scary, actually, just not being able to relax, ever.
Sounds exhausting.
Yeah. Sorry.
It's okay, it's all right. Do you feel there is an underlying cause?
Probably, but if I haven't figured out what it is by now, you know, I mean, how do you fix an underlying cause? Like, we've been through everything.
Well, the cause of it I know now to be mainly an undiagnosed dyspraxia, and the effect that that had on me, not knowing that, and having people tell me how I should be versus what I am. It caused a lot of low self-esteem. It's often pegged as a coordination disorder, but it involves an awful lot of sensory processing difficulties, and social cues, not understanding those. It's kind of, it's all over the place, really. There's a lot of things that you can find difficult when you're a dyspraxic.
What I think I'd like to do, I think it might be worth having you reviewed by a psychiatrist, actually.
Okay. Yeah, thank you.
All right, I'll organise that for you today.
Thank you. I struggle every day with it, really. I don't tend to let it show that much that I struggle with it, but in reality, I struggle as much as I always have.
Hey, Pickle, you all right?
Yeah, I am.
It's intense.
Yeah. I don't even know if any of this will help, but someone willing to try.
Yeah.
Is that I'm willing to try. And oh my word, it just means so much.
In terms of not pulling my hair out, I think the most helpful thing for me has been treatment for anxiety. There's a lot of things there that I can think my way out of, and as a result, they don't seem to stop me from pulling my hair immediately, but I notice it's significantly reduced when I'm in a place that I'm controlling it.
Come and have a seat here. So, well, hello.
Hi.
Okay, I'm a psychiatrist, and we diagnose and treat mental illness.
Okay.
So that's the sort of agenda, really.
That makes sense. Yes, that's fine. I would just quite like to get to the bottom of what it is that's wrong with me. You know what I mean? Because there have been different diagnoses. Obviously, no, I have trichotillomania, but yeah, like they don't really know what's going on.
Right. So that's a bit worrying for you. No one knows what they're doing.
Yeah, basically, everyone I've seen has never really spent enough time to figure it out.
Oh, okay. What do you want for the future? How do you see your life?
I just want to be able to function normally, not be pulling my hair out, and, you know, and maybe actually have some explanation of why all of this stuff is the case, you know, like why I'm bad at so much stuff.
You're bad at so much stuff.
Yeah, like at school and stuff, I was
Okay.
bad at all this, you know, bad at writing, bad at maths, bad at concentrating, like daydream all the time and stuff like that. Sorry.
Why do you say sorry?
Because, I don't know. See, now I'm getting emotional again. What is that? I'm okay.
Why are you getting emotional
I don't
now?
know. Sorry.
Well, okay, you say you're getting emotional, and you know, I can see that, but then you suddenly said sorry and starting apologising. and-
Yeah, I do that a lot, apparently.
Where's that come from?
Probably from the relationships, constantly having to apologise, and at school as well. Sorry, I did this wrong. Sorry, I forgot my homework. Sorry, I can't get this right.
You're really upset, aren't you, with all this?
It's been like forever. I've just been feeling like this forever. It's just frustrating. I just don't know why it is that I can't do these things like other people can do them. Why I'm slower than everybody else. Why I don't understand things the same way everybody else understands things. Why did I end up just, I don't know.
My treatment for anxiety involved a lot of thinking about things very differently, understanding where it was that I might be in the wrong about how I thought about the world and myself. It's a case of thinking again and again and again in a particular way until it becomes a natural habit.
What I've been doing this afternoon is carefully listening to the patterns of behaviour you tell me and the symptoms. With now a more promising ground, because now we've got a diagnosis of recurrent severe anxiety and OCD, which describes all your symptoms,
Yeah.
pulling your hair out and so on. And what's for sure is that's affected the way you think about yourself, isn't it? You now think of yourself as being stupid, don't you? And you have to apologise all the time,
Yeah.
which is kind of...
I think of myself as someone that can't succeed at things, can't deliver what people expect, what people want, and it has troubled me forever. And I guess maybe that's why I feel anxious, perhaps.
OK. So that makes sense, doesn't it?
Yeah, I guess I've never put the two together.
That's the key issue, that a lot of this is caused by the way you feel about your clumsiness, about your chaotic thinking, and that your self-esteem, your anxiety, and your OCD, pulling your hair out, all linked to that.
I think so.
That's what you've told me.
Yeah, that's it. Feels right.
What do you think about some psychological help at a sort of practical level about trying to correct some of these problems that you have?
I think I would really benefit from that, actually.
Yeah.
Like something to tell me things are all right or something.
Daycare was a very stressful time for me. I used to dread going, but be ultimately pleased that I had gone, because it was hard work. Even though most of it was just listening and thinking about things and understanding, it involved me going into a part of my brain and a part of my life that I had previously put a lid on, and it was quite exhausting actually. The aspects of daycare that were helpful were hearing other people's experiences with similar challenges, just understanding how other people could have got to that point, helped me understand how I could have got to that point. And also just understanding the very basics of anxiety and why certain thought processes happen helped me to go back and change them. Not with success every day, and still to this day I think in ways that I shouldn't be thinking, but I still don't see that as a bad thing. It's just another experience and another chance to change it.
That's probably about enough for today, isn't it? Does that sound all right? You've done fantastically well talking to me today.
Thank you.
Come on then.
Oh, hugs.
Okay.
Today, I have learned that I don't see myself in any kind of good way, and that the key, I think, is how to increase my self-esteem.
Right.
Yeah, it's good.
Cuddle.
It's good tips.
Yeah, good.
All of the stuff that they're going to do for me, it's just... It's
That's
really,
amazing, yeah.
really good. I didn't think any of this was possible.
I mean, my experience over the years of people in the mental health sector hasn't been entirely positive. I find that and it's not their fault, there's not enough training or emphasis on these kinds of disorders. And I find it really is probably just very important to listen to each individual person and understand what it is that they don't understand themselves, because that's the important bit, is that they don't understand what's going on 90% of the time, I would imagine. So yeah, maybe cut them a bit of slack if you're not going to. Unhelpful to me would be people thinking that they know more about your condition than you do when they haven't actually studied it at all. And you know, when they Google it in front of you and then tell you how it is, it's not particularly reassuring. Actually having people feel like it's an important thing, and that they need to ask questions to understand. People are often terrified to ask questions, but I always encourage it, because if somebody doesn't know how an individual is feeling about something, they're never really going to understand from any kind of perspective. And some people don't ask the right questions or any questions. One of the most important things I would say is just to listen.
Come in.
Hello.
Hey.
Hello there.
Ah.
Hiya.
How are you? You Nathan?
Yes, I am, yes.
I'm Kirsty. Kirsty, come and have a seat. Hi, Nathan. Nice to meet you. Please, be seated. You've been through quite a lot today, haven't you?
Yes.
In a good way?
A very good way, yes.
Really?
very, very good way, yeah.
Very, very good.
It's been extremely helpful and very promising, and yeah.
What have been the conclusions that you sort of are going to take away?
In terms of figuring out why I pull my hair, a lot of my problems are basically stemming from how I see myself, and we've sort of discovered that there's a few things that have knocked my self-esteem right down, and basically anxiety and OCD seems to have come from that.
And has that resonated with you? That's you've
Yes.
realised?
The show itself was fantastic in raising awareness, and I can see why an awful lot of people would find that to be an extreme tool. And I'm very happy that that happened, and the aftercare was completely priceless. I couldn't have asked for better, so. The aftercare involved being appointed a psychiatrist and going into daycare for one session a week for many weeks, and then again a few months later for a few weeks. And those daycare sessions and anxiety workshops and sessions with the psychiatrist and my key worker were completely on point, talking through and getting to the bottom of what was actually the issue, rather than paying attention to what my hair looked like. The biggest changes that I've noticed have been in the way I think about myself. I know now not to look to other people for understanding of the world.
I hope whilst getting to those revelations has been fairly arduous.
Yeah, it's been.
It's also kind of a,
It's been tough and it's been hard work and it's not over, but I am relieved.
We'll keep going, we'll look further. The help is there, things are lined up for you, and let's see how you go. All right, I wish you the best of that, and thank you for coming today.
Thank you. Emotionally, I just feel lighter and calmer and just very happy. So I think it's, the start of something great. I think that there is every chance that I can stop one day, and I'm just looking forward to trying.
About 3 weeks ago, I had an episode of very low mood, and I had been pulling my hair out an awful lot, so it caused a patch at the top that I just couldn't really cover anymore without feeling confident. So, as I have done many times before, I decided to start again and shaved it off. I'm not entirely sure how I see the future of my hair. I just sort of take it day by day. There's no ultimate plan, because if I plan it, then if it doesn't get better or it has hiccups like it did this time, then I will be upset, and I don't need to be, so. I have phases that I feel depressed, and I was worried about going into a state of depression, but that only lasted a few days and was probably due to other experiences in my life at the moment. I came back out of that quite well, so. I would say to fellow sufferers of trichotillomania that other people's responses are going to make you irate, but only you know what it is that can help. And I promise you, it's not on the outside, it's on the inside. No amount of shaving your head will make you feel immediately better. And it's important to understand the thought processes behind it. That's what got me anyway. I've left one relationship and I've got into another one. And now in this current relationship, we are having a baby and I'm 6 months pregnant. And it took a lot of endurance to get into this current relationship, but we're very happy and it's an extremely stable relationship. The reason the treatment has helped the quality of my relationship is that when somebody's expecting something of me, I know whether or not that expectation is a fair one and whether it's achievable. And in turn, that enables me to know what I would expect from them and whether or not they're giving me what I deserve and what is reasonable for them. In terms of the relationship I'm in, it's definitely given me the confidence to go for something that really suits me best. Let's see where this relationship goes.
She's grown in confidence. and is able to handle stressful situations. I mean, pregnancy isn't the most stress-free time of life, and you've handled a lot of that really well.
I think I'm able to put it into perspective more.
Yeah.
It certainly helps having some perspective and understanding what it is that's actually important versus the little things that really aren't important at all.
Yeah, and I think as you kind of get to know yourself and be okay with yourself, and you begin to kind of develop strategies for coping with your dyspraxia and all that, which means you're not as anxious as you used to be as well, which is really good to see.
Yeah, I'm definitely able to recognise when it is I'm getting to be anxious, and even if it's a time where I can't particularly handle it very well, I certainly know how to recover from it better and deal with it the next time.
Yeah. And that level of self-worth also means that your relationships are healthier too.
Yeah, definitely. Ezra's made me feel a lot better about myself. When I look at her, I feel like I've achieved something, and that doesn't go away. So it's a good confidence boost. I do still get quite anxious, but it's not the same. When I can put things into perspective, since having Ezra, it's a lot better because she's the most important thing. So anything I'm worried about isn't nearly as important as she is. So it really helps me just go, well, Ezra's okay, so I'm okay. Sometimes she doesn't actually let me pull my hair out because when I go to do it, she cries and I need to hold her. But otherwise, me being calm anyway helps me not pull my hair, so. About a year ago, I was an awful lot more anxious. When something would happen, I would take it to heart and obsess about it for days or hours at a time. Whereas now I can quite quickly talk myself down, make myself realise that things aren't all that, and it's a lot easier now. My hair's a lot better now than it used to be. Apparently, people keep saying that anyway. But I'm sort of able to cover any patches or thinning with the rest of it at the moment. I'm a bit more confident about it. I think I might get it cut soon, actually. But yeah, I'm pulling it a lot less. And I think that's just because I'm a bit more relaxed. I do get anxious sometimes, and when I do get more anxious, I pull it a lot more. But at the moment, I'm okay. I think the most important thing is to get the anxiety sorted before you try and stop pulling your hair out, because if you just go ahead and try, it's not like giving up on an addiction or anything. You really have to get to the root of the problem. That's a bad pun. But basically, you really have to get down into the problem before you can start stopping the pulling, because the main bit is talking therapy is probably the best thing for it. You don't pull your hair out for no reason. It's probably something underneath. The treatment I had at the clinic was really in-depth. It described anxiety and depression, and it went through all of the patterns in which they arrive. So it went through behaviours and feelings and thoughts, and which to tackle first and when, and how to notice the things coming. So being able to recognise the problem is like the first step, and then they taught that and what anxiety looks like, and then they even got down to sort of why we have it and our brain chemistry and evolution and things like that. It was really in depth. And then we had some other group therapies where we just talked about our problems, and that was always interesting. Yeah, it was a lot of learning and a lot of talking about feelings. It was nice. I was mostly just really wanting to recap on where I was now compared to where I was in the beginning and where I was the last time we spoke. It's really good to keep track of the improvement and also anything that's come back since. So sometimes I do get anxious, especially now I'm not pregnant. Being pregnant really helped. Whereas now I don't have all the hormones helping me, it's just anxiety when it comes. So I have to really use my practice and use the tools that I've got and try and remember everything.